So, by now, you are familiar with how a sperm fertilizes an egg, and the series of events that takes place in the process of fertilization, and how zygote undergoes cleavage to form morula, that develops into blastocyst, which is implanted in the uterus, how placenta is formed, and it releases hormones to maintain pregnancy. Now here, in this particular part, we are going to focus specifically on the changes that occur in the mother's body during pregnancy. Well, there are various changes in the mother's body during pregnancy, including structural changes in primary sex organs, mammary glands, body weight, metabolic changes, and changes in physiological organ systems of the body. So, starting off with the weight of a pregnant woman. Well, the average weight gained by the body during pregnancy is about 12 kilograms. Approximate weight of various structures which adds to the weight gain include fetus, about 3.5 kilograms, amniotic fluid, about 2 kilograms, placenta, adding a weight of about 1.5 kilograms, while increase in maternal body weight is about 5 kilograms. That makes up a total of 12 kilograms. But that's not always the case. If proper prenatal care is not taken, the body weight can even increase greatly by about 20 to 30 kilograms. Next up are the changes in the metabolism. Well, the metabolic activities are accelerated in the body due to increased secretion of various hormones, like thyroxine, cortisol, and sex hormones. Hormone secretion increases the basal metabolic rate by about 15% in the later stages of pregnancy. Also, an increase in anabolism of proteins is observed, and protein deposition increases in uterus. Blood glucose level increases, leading to glucosuria. Ketosis develops, either due to less food or more vomiting. Because of all these reasons, there is hyperplasia of beta cells, of islets of Langerhans, in pancreas, leading to increase in secretion of insulin. In spite of this, there is possibility of developing diabetes in pregnancy, or latent diabetes after delivery. Also, there's a fat deposition of about 3 to 4 kilograms, increasing the blood cholesterol level and ketosis. Not only this, but there's an increase in the retention of sodium, water, calcium, and phosphorus. Now, if we have a look at the structural changes in pregnancy, we'll observe that there is an increase in the size of vagina. It turns violet in color due to increased blood supply, and there is glycogen deposition in the epithelial cells. The number of glands, blood supply, and mucus secretion increase in cervix. It becomes soft and is closed by mucus plug. Also, the number of epithelial cells and blood supply increase in fallopian tubes. As for the mammary glands, their size increases because of development of new ducts and alveoli, deposition of fat, and increased vascularization. Also, there's an increased pigmentation of nipple and areola. Talking about ovaries, follicular changes do not appear in ovary, and ovulation does not occur. Corpus luteum enlarges and secretes a large quantity of progesterone and little estrogen, which are essential for maintaining the pregnancy. Now, when the fetus grows, uterus undergoes changes in volume, size, shape, and weight. During the first 16 weeks of gestation, it grows from the size of a fist until it occupies most of the pelvic cavity. As pregnancy continues, the uterus expands until it reaches the level of the xiphoid process and fills most of the abdominal cavity. The uterus increases from its non-pregnant weight of 50 grams to about 900 grams. By the end of pregnancy, endometrium shows formation of decidua. The shape of non-pregnant uterus is piriform. As the fetus grows at the 12th week of pregnancy, it becomes globular. Then, once again, it becomes piriform gradually. Now, we are left with the changes in physiological systems of the pregnant woman. There's a change in the digestive system, cardiovascular system, respiratory system, urinary system, integumentary system, nervous system. Well, don't mind the images of males used here. These are just for depiction of the organ systems and has nothing to do with the maternal changes. Anyways, let's look into these changes now. First, we have digestive system. Well, during the first 3 months of pregnancy, morning sickness commonly occur, involving nausea, vomiting, and dizziness. Constipation often results from decreased intestinal motility by progesterone. Heartburn frequently occurs later in the pregnancy, as the enlarging uterus presses upward on the stomach. Next up is the cardiovascular system. Well, the mother's blood volume increases 30% to 50%. Cardiac output increases 30% to 40% by week 27, as the uterus demands more blood. And there's also an increase in heart rate. Later in pregnancy, the uterus exerts pressure on pelvic blood vessels, interfering with venous return. As a result, hemorrhoids, varicose veins, and swelling in the feet may be seen. Now, next is the respiratory system. Well, ventilation increases about 50% to meet the developing fetus' increased demands for oxygen. Late in pregnancy, the enlarged uterus pushes against the diaphragm, often causing shortness of breath. Also, an increased estrogen levels cause the nasal mucosa to swell, resulting in nasal stuffiness. Now, changes in urinary system. Well, the glomerular filtration rate increases to deal with the added burden of disposing of the fetus waste. This leads to a slightly elevated urine output. While, in the later in pregnancy, the enlarged uterus presses on the bladder and reduces its capacity. This leads to increased frequency of urination. So, next on the list is integumentary system. Now, the skin of the abdomen grows and stretches to accommodate the expanding uterus, often leading to stretch marks or stria. Skin over the breasts also grows, as breasts enlarge in preparation for milk production. An increase in melanocyte-stimulating hormone and estrogen darkens areola and creates a line of pigment from the umbilicus to the pubis, called the linea nigra. Melanin production may also discolor skin on the face to create closma, or mask of pregnancy. Next on the list is nervous system. There is general excitement of nervous system during pregnancy. It leads to the psychological imbalance, such as change in the moods, excitement or depression in the early stages of pregnancy. During the later months of pregnancy, the woman becomes very much excited because of anticipation of delivery of the baby and labor pain. Now lastly, we have endocrine system. So, what changes occur here are that during pregnancy, the size of anterior pituitary increases by about 50%, and secretion of corticotropin, thyrotropin, and prolactin increases. However, the secretion of follicle-stimulating hormone and luteinizing hormone decreases very much. What can be the reason? Yes, it is because of negative feedback control by estrogen and progesterone, which are continuously secreted from corpus luteum initially and placenta later on. Also, there is an increase in secretion of cortisol, which helps in the mobilization of amino acids from the mother's tissues to the fetus. Aldosterone secretion also increases. That is responsible for the retention of water and sodium. The size and the secretory activity of thyroid gland increase during pregnancy. The increased secretion of thyroxine helps in the preparation of mammary glands for lactation and also increases basal metabolic rate. Parathyroid glands also show an increase in the size and secretory activity. Parathyroid is responsible for maintenance of calcium level in mother's blood, in spite of loss of large amount of calcium to fetus. So, that concludes our discussion of maternal changes during pregnancy. We talked about the changes that happen in the mother's body during pregnancy. Changes in body weight, as well as changes in metabolism, various structural changes, and the changes that occur in diverse physiological organ systems. I hope you enjoyed this fertilization and pregnancy video. If you haven't already, check our prior videos on endocrine regulation of reproduction and sexual differentiation and function to have a better understanding of the subject. Also, keep an eye out for the future video about parturition or birth on sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.